Hi, my name is Madison Sykosh, and for my facility creation project, I made a physical therapy and rehab center called Joint Effort. So, Joint Effort's location is going to be in Youngstown, Ohio, at 3020 Belmont Avenue. It used to be a eye doctor clinic. They also used to do very small procedures at this location, and it is a commercial facility. The building size is about 7,889 square feet, and it is 1 story tall. The lot size is 0.68 acres, and it is a total of $350,000. Some modifications I would make, I would add some private treatment rooms. In these rooms, we could do stimulation therapy, we could do ultrasound therapy, we could do massage therapy, and we could even do initial evaluations in these rooms as well. I would also need to upgrade the wheelchair accessibility just because this specific location was last renovated in the late 80s, I believe. So wheelchair accessibility has been upgraded since then. So I would have to make some updates with that. And then I would also install more private offices just for our PTs, just to make them have their own private space where they can work privately. So our facility layout, the total square footage that we are working with is 7,889 square feet. The reception or lobby is going to be a shared space, and it will be 1,200 square feet. The gym, so where the equipment is and all of the lifting materials will be 2,689 square feet. Private treatment rooms that we talked about in the last slide will be 2,000 square feet. Private offices for the physical therapists will be 1,920 square feet. And then our restroom, which also is going to be handicap accessible, will be 80 square feet. So for our mission statement, here at Joint Effort Physical Therapy and Rehab Center, our mission is to restore every patient to move, heal, and have a better quality of life. We as a team are dedicated to restoring strength, improving mobility, and reducing your pain by assisting you in the care you need. We believe recovery is a joint effort between patient and provider, built on trust and support. Here is my logo for Joint Effort. As you will notice, there is a butterfly, and underneath Joint Effort it says change starts here. I really like this because the butterfly symbolizes change, and I think that that is very important when it comes to physical therapy because we are trying to change your body for the better. So as you can see here is a list of supplies and equipment we would need to purchase before we opened the facility. So treadmills are super important and beneficial because number one, the physical therapist can stay in one area and watch you and not have to like go outside and run. So it's very stationary. It also is super beneficial to people who need to be evaluated on their gait while they run or walk, just to make sure that they are not overcompensating for the other leg that is hurt. It's also beneficial if you have recently got off of crutches and you're just starting to walk. Being able to hold on the sides of the treadmill is very beneficial. So 3 of those, which have to also be PT grade, they have to be specially graded just for the safety of patients. And these are about $24,000 altogether for 3 of them. Exercise bikes are super nice, especially if you have just gotten off of your crutches or you're on one crutch, so you're just starting to be able to walk, but it's kind of uncomfortable to be on your feet for a long period of time. Being able to sit and also work on that range of motion is super, super beneficial. So we would probably buy 2 of those, and that would equal about $6,000. Resistance bands are super beneficial for small movements, especially in the beginning where you're limited to standing. We would get 10 of these, and that would equal about $100. These resistance bands will also be different resistance, so 2 pounds up to 10 pounds. Then we would also buy a leg extension and flexion machine. So this would help the quads and the hamstrings for development through physical therapy. These are super beneficial out of knee surgery. Just trying to get that strength back in both of those muscles is super important. And it's also nice because you can also sit down, so you can use these pretty early on as well. And these are about $650. We would also buy a leg press machine. These are super beneficial because it's not as hard on you as standing up and doing like a typical back squat, but they're just as beneficial in using the same muscle groups. And we would buy one of these, and that is $2,000. Parallel balance bars, these would be 7 feet long, and they're just standing next to each other. These are good when you're just learning how to walk again, straight out of surgery, or if you have bad ankles, bad knees, anything, these can be super beneficial. You can also do squats in between these and also have support while you're doing them, just trying to get that feeling back. We would also have a pulley machine with multiple attachments. So this is more so for upper body. There would be a pull down cable, and there would just be multiple different attachments. The attachments also could be lowered, so you could use them on your legs as well. But these are beneficial for elbow injuries, shoulder injuries, anything of that nature. And this would be about $10,000 just because there's a lot of different attachments and a lot of different uses. We would also buy dumbbells, 2 pounds up to 15 pounds for $150. And then these last couple are not required at physical therapy places, but I think that they are super beneficial to make patients more comfortable. Ultrasound therapy, it just sends heat basically internally through whatever you are using it on, whether that be your elbow, your knee. Electric stimulation machine is $4,000. And sorry, the ultrasound therapy machine is $1,000. The electrical stimulation machine is $4,000. Treatment tables, we need these obviously to evaluate typically initial evaluation or even just measuring range of motion. They're very useful for, and this is about $10,000. And office equipment, whether that be computers, chairs, desks, that's going to equal about $10,000. So our total is $68,700. For our treatment that we offer here at Joint Effort, we offer post-surgery rehab, sports injury rehab, chronic pain rehab or management, balance and mobility, stim machine therapy, ultrasound therapy, and massage therapy. So here's our flyer for Joint Effort. This on it just says what we treat, which we just talked about in the last slide, and also our little memo, the change starts here, along with our mission statement that I have read in a previous slide. Our patient goal here at Joint Effort is to hopefully be 250 to 300 visits per month, which equals about 12 to 18 patients a day. Key features that we have here are one-on-one physical therapy sessions. Ultrasound, stimulation, and massage therapy are all available to any patient who feels that they would need it or the physical therapist can recommend it. And friendly, accommodating staff. Here's our staff table. So the types of people that we have working here is a clinical director. We will have one of those, and their job is basically to oversee the rehab center and make sure everything's running smoothly, and they make about $90,000 a year. Physical therapists, we would have 6 of those. They're kind of the people that keep this running. They're the ones who make treatments for patients. They make the plans. They do the plans and watch the patients and make sure that they are improving their mobility. And they make anywhere from $80,000 to $100,000 a year. Physical therapy assistants, we will have 4 of those. And they're kind of helping the therapy sessions move along smoothly. And they make about $45,000 a year. We would have physical therapist technicians, and we would have 2 of those. Their job is relatively similar to physical therapy assistants, except they do not have a degree. And they just kind of assist with patient care. They kind of go around and help the physical therapist, whether that be going and getting a pillow for a patient, or rolling over a stimulation machine, or just helping the patient get up and move around. And they make about $30,000 a year. And then front desk, we need them in order to schedule and not overlap patients. There would be 3 of those, and they make about $35,000 a year. And then lastly, we would have medical assistants. We would have 2 of those, and they are responsible for patient prep and support. And they make about $38,000 a year. Our revenue, our insurance reimbursements is 300 patients per month multiplied by $250. That $250 is the initial evaluation of when they come in to so we can make a plan for them, plus the visits, which one visit is $100. So that equals $900,000 a year. Private therapy sessions equal $150,000 a year. So that added together is $1,050,000 per year that we will be making in revenue. Target markets are really anyone who needs mobility improved. Anyone is welcome here, but our top 3 are post-surgery patients. Number 2 is athletes, and number 3 is chronic pain patients. Our hours of operation, we are open Monday through Friday, 8 a.m. to 6 p.m. On Saturday, we're open 9 a.m. to 3 p.m. and on Sunday, we are closed. Visit pricing. So the initial valuation when you first come in and we see what exactly we can do to improve your quality of life, that is $150. And then per session is roughly $100. Now we have special plans for longer recovery, so 8+ months. This could be for a complete reconstruction surgery. These typically take up to a year for healing, and we know that that adds up. So we just want to make sure that it is definitely as easy for you to pay for as possible. So we do have special plans for longer recoveries. Our patient care policy is very important to us because we just want to make sure that you have a positive and safe experience with us. So number 1, you need initial screening before you come visit us. This includes like an MRI or an X-ray, anything of that sort. You also need a doctor referral. Number 3, treatment plans will be updated every 4 weeks or every month. And number 4, you must sign a consent form before participating in therapy, just to make sure that we are keeping you safe and you have a positive experience. Our facility policy, so this is for all of our workers. Number 1, sanitize after every patient/session. Everyone deserves a clean space. Number 2, equipment is to be inspected daily. These people are already coming to us hurt, so we don't want to further that or make it worse. Number 3, HIPAA compliance. Number 4, in case of any emergency, a plan is to be in place that everyone is aware of. Now, this could be a fire, this could be a tornado, this could be someone passing out. This could be literally anything that is classified as an emergency. There needs to be a plan in place just so everyone's on the same page. And number 5, just be kind. And lastly, risk management. So number 1, fall prevention. Number 2, everyone needs to be CPR certified. Number 3, infection protocol. So if you work here and you're sick, please do not come to work. If you are a patient and you're not feeling well, we also ask that you please do not come in. We don't want any patient to make our staff sick, and we don't want our staff to make any patient sick. We just want to keep everyone safe. Number 4, an incident report system. This is just to make sure everybody's honest and on the same page. Number 5, safe lifting patient training. So being able to transfer a patient off a bed onto another bed, anything like that, just being able to help them up. We just don't want to hurt them further. So I think that having a training program to make sure everyone knows how to do that is very important. That's all I have. Thank you for your time.